Mid last year, the Ministry of Health scaled down mass vaccination for COVID-19 as cases went down. At the moment, the vaccines are placed at health centers and public hospitals across the country. However, the response from the public taking up vaccination has declined tremendously.
From the current record, we don't see any heightened number of people taking up vaccines. There are fewer, and the majority of the people are now vaccinating those children who are just becoming 18, or those who are going for travel or going for school, people going abroad, and the people who are frequently now coming for vaccines. The general population, the people coming currently are those looking for booster doses. But we want to call upon, because we have a big majority of people who never received their second doses. So these should be encouraged to come.
Although the number of COVID-19 positive cases is not alarming, information from the Ministry of Health shows that the country is still registering some cases.
Currently in the country, we have not yet detected the new variant, but because the disease is still circulating, we are still seeing between 70 and 75 people positive for COVID in every 2 weeks for the last 3 months. So that means this gives a fertile room for the variants also to circulate. And we know that people are still going to all these countries, China, Japan, and the US, and they're likely to come back with these different variants.
One of the country's principal epidemiologists and also Minister for Science, Technology and Innovation, Dr. Monica Musenero, has now advised the population to embrace COVID-19 vaccination.
The threat is real in the world. China has just opened up. They didn't open up because the COVID went down. They opened up, I think, because of other issues in the ecosystem in their country. And the Chinese people start traveling, and they have been having this challenge. We know that in the US, they have very unique variants now. The Omicron, the newest variant of Omicron, which has come. And the recent report is that it has reached South Africa. Now, if Ugandans remember, many of these variants have reached us through South Africa because of the travel connections. This is nothing about South Africa, but because of the travel connections, and also because South Africa is very keen on looking after, to find these. So it has been reported, and that means that anytime we are going to have those variants. Now, we don't know what they will do in our population, and I've also been watching some of the data in Uganda. It shows that we are having some hints of cases showing up here and there. We still don't know what exact trend it will take, but we have some cases now beginning to show up in hospital. So I would advise Ugandans, if you're not vaccinated and you're above 18, go to your nearest facility and get your vaccine shot. If you got the first one, please go and get your second shot.
Uganda received about 48 million doses of COVID-19 vaccines, and only 28 million have been utilized.
We have a lot of Johnson & Johnson because it has a very long shelf life. We received as a government purchase, which had a very long shelf life. So,
Ministry of Health statistics show that only 53% of the eligible population is fully vaccinated. Adiana Kuti, UBC.